Good morning. My name is Jane Manette, and it's December 20th, and I'm just delighted to be here. I'm delighted to participate in this really meaningful experience of hearing from two physicians, their clinical experience and their personal experience for using these phenomenal products that we've all benefited from or interested in benefiting from. So first, without any further ado, it's an honor to be here. And please just tell me a little about your background and your practice and what kind of practice you have, doctors.
All right. Thank you, Jane. I will start. I'm the medical director of the Brain Restoration Clinic. I work with my twin brother, Dr. Paul Corbier. And my background medically is I'm a board certified neurologist with special qualifications in child neurology. I started my training in Michigan, so we have a lot of friends from Detroit. We went to Michigan State University for med school, and I did some training in neurology at the U of M as well. And I always knew I wanted to become a neurologist first adult, but then I decided to go into child neurology. I was influenced by Dr. Benjamin Carson, the famous pediatric neurosurgeon who also lived in Michigan and came to visit, in our university where we went to school for college. My goal, I was ambitious. My goal was to be the best pediatric neurologist I could be. And so I ended up going to different places like Johns Hopkins University, the Mayo Clinic for additional neurology training, went to University of London and did some medical seminars in other places like Israel, India. Like you, we've lived in Africa for 7 years as well, doing missionary work. And so the goal was to get as broad-based and well-trained as possible. I worked in the hospital for the first few years. It's looking back, it's been almost 30 years since I graduated from medical school, and almost 25 years doing full practice neurology, child neurology. But we migrated from traditional to more wellness-based integrative health, and later was joined by my twin brother. We worked together, and he'll introduce himself. We see every single patient together. That was a dream of ours. So in a nutshell, that's who I am. Our clinic is called the Brain Restoration Clinic.
Wow, that's impressive. Thank you for that.
You're welcome.
Dr. Corbier?
Sure, just a few words as well. So my name is Paul, and because we're twins, my job is easy. Everything he says applies to me too as a twin,
Of course.
except that I am actually boarded in internal medicine. And so my focus has been more on adult care and even geriatric care. I started my practice working in a multi-specialty practice in Central Florida, where we had anywhere from, plastic surgeons to endocrinologists and every specialty you could think of, all in the same arena. And so I could consult with them and learn from them. But very early on, I found that nutritional supplements, dietary supplements, needed to be part of the equation, not just medication, but lifestyle modification and the right supplementation to do well. Later on in my journey, I also was the medical director of hospice and palliative care. So I saw end-of-life issues like cancer and terminal disease. That gave me a perspective on life. And then I went into solo practice. I saw that aspect of juggling hospital care with my own private outpatient care. And then after that, I spent 10 years working in correctional medicine, working with prisoners. That was I had a sense of ministry, working with those behind bars and trying to provide healthcare to that population. Very gratifying and hard work, because they were very sick in that patient population with mental disease as well as significant medical issues. But I had a dream come true when in 2018, I was able to join my twin brother. And no, you're not seeing double. There are two of us. Your vision's okay. There are two of us. So to work together to complement each other's experiences to bring the best possible care in this brain restoration clinic.
Wow, how fascinating. Not only do we have similar interests, we've been some of the same places. I live in Florida in Sebring,
Ah,
and
oh, I know where that
right.
is. Yeah,
And
yeah.
I've lived and was educated in Michigan, and I lived
Ah,
in Africa for 7 years.
Yes.
And
wow.
I also used to do work in prisons as well. So
Ah,
we have
wow.
a lot
A
in
lot in
A
common.
lot in common,
lot in
yes.
common. I look forward to us having some time to share more of our shared experiences. So getting right into our agenda, how long have you been using Micro Daily products?
So we've been using it for a good 10 months and first heard about it through Beth Sturdivant and Denise Blankenship, who introduced us. We had known Beth and Denise for a while. So when they mentioned this, we took it very seriously. First, we wanted to try it on ourselves and then on our patients. So I would say for the past 10 months, we've been engaged in the use of the Micro Daily supplements.
And tell me, what has been your personal results and experience from using the product, and how long did it take you to start noticing some results?
I'll start, then I'll let my brother. So
Okay,
the personal experience has been that it has given us both mental and physical vigor and energy, which we really need for our job since we wake up quite early every day and we work, and our job is tasking, emotionally and mentally and even physically. And so that stamina has improved, but also we're around sick patients. And so we feel that our immune system is strengthened, among other things.
sure.
And it took, I would say, days to weeks, to kind of start feeling some good benefits.
And if I say Dr. Corbier, that's both of you. So I'm going to say Dr. Paul Corbier.
Yeah,
How
there
has
you
been
go.
your experience, right?
Sure, yes. So I agree with what my twin brother says. We don't always agree, but on
Of
this we
course.
do agree. That's it, but I will also add that sense of well-being. We know that we're giving our bodies good nutritional supplementation. So just that sense of feeding ourselves with the right ingredients, the right combination. So after a couple, 2 or 3 weeks, I really felt that, hey, this is good. I feel good. And as my brother said, people are sick around us, but our immunity is real and we just feel good.
Yeah, well, that's wonderful, because you certainly are around a lot of people with compromised immune systems in a very stressful state, and of course that has its effect on you. And those long hours definitely is a part of the job you signed up for sure, for sure. What has been your personal experience with Dr. Prasad, and how does his products and research stand out from others that you've seen in the past?
Yes. So first, let me say that almost from the very beginning, we've been interested in what I would call nutritional neurology. So I failed to mention, but after I started working as a full-fledged neurologist, pediatric neurologist, I was very interested in autism. And kids with autism have a lot of nutritional needs. And I can remember early on in my career, parents would say, hey, my kid's not eating or has gastrointestinal, what do you recommend? And I knew no better. I would say, go to the store, pick up a vitamin. And they would say, but which one?
Yeah.
Well, fast forward, we've looked at a lot of nutrients and supplements. And when we came across the Micro Daily and have had a chance to talk to Dr. Prasad, we're very impressed with the research behind the supplements. They're very well formulated, carefully formulated. We find Dr. Prasad to be a not only very intelligent, well-informed researcher, scientist, formulator, but also humble. That counts. So we can feel the passion, the dedication, and so that led us to really, meet with Dr. Prasad. We're starting to work on protocols so that we can help our patients. So we've had a very beneficial, meaningful interaction, which is ongoing with Dr. Prasad.
Yeah,
Yeah.
I'll just also add that he's been very approachable. We have the same vision of supporting our community and to be able to, as my brother said, to work on protocols together and with scientifically validated products. I think it's a win-win situation, not just so much for us, but for the patients that we care about in terms of their health and well-being.
And Dr. Paul, as a physician and in practice with your brother and being orientated and open to wellness, How has this product kind of brought you a kind of comfort and security in knowing that it is safe to share with others, other practitioners, as well as your patients? How has Dr. Prasad's regime and program and background, passion, commitment, and research, what kind of security and comfort does that bring you?
Well, the kind of patients that we have, they themselves like research. They have questions. They want to know that things have been vetted. They want to go back to the research, evidence-based things. So the comfort and security we have is to know that we have nothing to be ashamed of. These products are well researched, ones that we've taken ourselves. And so it brings us a lot of peace and comfort to know that we can rely on products that we truly believe in, that we've looked at the research, we see how it works, we understand the ingredients involved in it, and we can answer questions and point our patients to the right direction in terms of getting informed and being reassured that they're getting really the right products that they need. We have very sick patients, and so to have these available is really a sense of comfort to us in our practice.
Oh, that's wonderful. Your patients are so fortunate to have you, so fortunate to have you. Is there a particular group in your patient population that you're focusing on with these products? And is there any particular product that you find you end up recommending more than others, and why?
All right, so our big focus is the brain at the Brain Restoration Clinic. So we have a lot of neurological patients with, say, neuroimmune conditions. There's a condition called PANS and PANDAS, where you may have an infection like strep, but then it turns into a neuropsychiatric condition that can be very severe. We have a lot of neurodevelopmental/special needs kids like autism, and these children oftentimes have a lot of nutritional requirements and needs. So that's a big focus. We're seeing more and more post-COVID symptom patients. So a lot of our patients end up having neuroimmune issues, neuroinflammation, things that we think that the micro daily supplements respond to: oxidative stress, inflammation. And so that's a large group of the patients we see. We see a lot of epilepsy and other things as well.
Is there go on, yes, Dr.
No, I was just saying that, and so because of this complexity, what we recommend is the core products. So we think that they all could benefit from the EMF, which has all the right combination of vitamins, but in our line of work, anti-inflammatory properties like curcumin, CoQ10, mitochondrial health. So that probiotic gut health in our practice is also important. So that fits nicely. The core 4 also includes omega fatty acids. So we think that's important, omega-3, and the way it's formulated, and collagen peptides. So that's the foundation. But as my brother said, with all the focus issues, dementia, all these things that we're also concerned about, we also look at brain boosts and even CBD. If some of us are in front of a computer and we want our eyes, our vision to be better, we're happy that there's a product called iBoost that can also help with vision. So the core products are used, but then CBD and some of these other products, digestive enzymes, are also included to really help our patient needs.
And you're putting both adults and children on these products, right?
Yes, we're putting both adults and kids.
Go on, sir.
Oh, go ahead. No, I was just going to say, yes, we use these for both pediatric and adult patients. And, I was just going to reemphasize and reiterate that in addition to the core products, we do use a lot of, things like brain boosts and CBD boosts, because we have a lot of patients with neurobehavioral, neuropsychiatric issues. And so we find that the CBD boosts and the brain boosts really add to the core products for our particular patient population.
And we enjoy and also monitoring them. So it does require, because some of these patients are very sick. So that's why we're happy with the robust nature of these products and the monitoring, so we can titrate and respond to their needs and tweaking things as need be under our supervision.
You say that you have a very busy practice and long hours. I'm concerned that after we share this video with other people, you're going to be even busier, but you're prepared. You're prepared.
That's our passion to help. So
yes. So could you help us understand why our patented gummies for children are so unique. And we adults take them too. We take them in the afternoon for lifts if we're busy, before meetings, before calls. So the adults that are participating in our nutritional program use the gummies for their own personal use. But why do you think our patented gummies are so effective, and how are they unique from others that you've seen?
Yes. So we've looked at the gummies, and in light of our kids, again, in our particular practice, we see a lot of kids with neurological problems. And what we have found with the gummies, the micro daily gummies kid formulation, is that I would say they're more than just multivitamins. They have things in there, quercetin, antioxidants, CoQ10, and things that really help with the mitochondrial system. We also take care of kids with mitochondrial disorders, whether primary or secondary. So we see that everything's very well formulated, not just to help with growth, organ, bones, but also mental health, which is important. We have a lot of patients with attention deficit hyperactivity disorder and related problems. So getting good nutrition, again, we use the term nutritional neurology, what brain cells need to optimize their functioning, but also immune support, even things like quercetin to stabilize mast cells, as we have a lot of kids and adults with mast cell problems, activating syndrome that can lead to a number of difficulties. So these gummies are particularly carefully formulated. They also are methylated, the B12 and folate. We do have kids that have what we call cerebral folate deficiency. They may have normal folate or folic acid in the blood, but not enough in the brain where it counts. And so having a methylated form of 5-methyl tetrahydrofolate that can then be utilized for the brain can really help cognitively, behaviorally, and even in terms of seizures. So all of that are in the kids' formulation. There aren't any things like junk and additives and sweeteners, things that people react to sometimes. So we think that careful formulation and research went behind this kid formulation. Kids are not just small adults, they have very particular specialized needs, and having a nutritional supplement that can help with their growth, immune protection, neuroprotection is something that we need alongside our comprehensive approach of helping the kids.
And I would imagine that you would be recommending, or that you would recommend these products for not just sick children, but for well children to help them stay well. Is that true?
Absolutely. So we believe in maintenance. That's a big part of our philosophy is, maintenance and prevention of diseases. And so even though we see a lot of sick patients, parents will ask, what about the siblings, the brothers, the sisters? They look okay, they're healthy. We want them to stay that way. We say, absolutely, take these products and it'll help them. And of course, adults can take them. We take them ourselves as well. So it's good for anyone.
Very exciting, very exciting. What has been, Dr. Paul Corbier, what has been some of the most unexpected, amazing results that your patients have reported to you? I want you to go first.
Well, yes, sure. So we have patients that have very difficult to treat conditions, including autism. I'll mention that even though we think of autism in the younger age group, but we think of one that comes to mind who is in her 20s. She's in her 20s and has struggled with that condition in terms of speech and other challenges. Well, we put her on the core products plus the boost and digestive enzymes, the CBD, all these things together while monitoring her. And we see that she's doing well. My brother could say more about this, but when we get a call from mom who's really elated, that makes us happy because we call this a breakthrough clinically. So that comes to mind, or some of our very sick patients that we're really trying to do a lot of different things that we do in our practice, what we call neuromodulation, support, and we add this to the mix. We really see moving the needle in some improvement. So, but that's one case that comes to mind. Maybe my brother.
Let me just add to that particular case so we have several cases, but that one, I remember clearly one afternoon, mom called. Normally when I get a call like that after work, I sometimes think, what's going on? Is this someone I have to send to the hospital? But She was calling to give a testimonial of how transformed her 24-year-old with ASD was. And so she was very, very excited. And again, we did, the core, we added boost products, CBD boost, and that synergy we think really helped enough to motivate mom to call us in broad daylight, to tell us what was going on. I can also think of patients with seizures. Maybe we'll get into that a little bit more, but with the
Well, tell us, share that, please.
Yes.
Results, as we want.
Well, yeah. So we one of the challenges in neurology in general, and including pediatric neurology, is refractory seizures. So refractory seizures are seizure disorders that don't always respond to appropriately chosen anticonvulsant meds. And so this has led me personally many years ago to try to look at alternatives, non-pharmaceutical ways, dietary, ketogenic diet as well, back all the way in the 90s. We've been interested in CBD, and one of the discussions we've had with Dr. Prasad is regarding the CBD boost, purified form of CBD, kind of pharmaceutical grade. And we've had patients that had not done well with other types of interventions that we switch over to CBD boost at the appropriate dose. And we're seeing some great results in terms of seizure reduction, safety, because, we want to make sure that everything we recommend is safe. And so we're seeing good results that way in our patients.
Yeah, the FDA has approved a form of CBD to treat seizures in specific conditions. So we're very happy that the CBD, because again, we can monitor the titration, can have a lot of the same impact. So this is something even the FDA has looked at in its formulary of certain medication.
And maybe, Shane, let me touch on that a little bit more, because
Sure.
that's important, is that, so the FDA has approved a drug called Epidiolex, which is the first and only CBD-based FDA-approved drug for certain types of seizures, 3 types of seizures. One is called Lennox-Gastaut, the other one's Dravet syndrome, and then the third are seizures associated with the skin-brain neurocutaneous disorder called tuberous sclerosis. These are all very difficult to control seizures. So our patients with those, a lot of times they don't respond to meds. So they've done studies that found that CBD really helps in those very hard to treat intractable refractory conditions. The problem with Epidiolex, it does work, but it has sucralose, for example, an artificial sweetener and other things in there that we may not necessarily like. So to know that Dr. Prasad has CBD boost, which is very clean yet potent, is very good. We don't shy away from doses. Just to give you an example, an adult male with hard to control seizures can take a maximum of, let's say, 2,000 milligrams of CBD. An average kid could easily take 800 milligrams or more. So I mentioned that because we're able to not shy away from the appropriate therapeutic dose of CBD. We have even younger kids that take a good hefty dose of the CBD boost, and we see great results. And so we're happy to have that available to us for use with our patients.
This is very, very exciting, and I'm so appreciative that you are validating what our independent affiliates are telling us every day, and our customers. It's so good to hear that validation from you, and I'm sure others will be just as appreciative. Are there any kinds of health challenges or conditions that you see in your medical practice that seem to have the best response to micro daily products, or are people with a wide variety of conditions responding? But is there any particular group that has the best response from your experience, starting with you, Dr. Paul Corbier?
Okay, it's a tough question because we see so much. So again, our main focus in this brain restoration clinic has to do with neurologic health, brain health, but that's a wide range of things right there.
Right there, yeah.
Anxiety, depression, focus, mental clarity, mental energy, physical energy. So when we're putting people on these products, someone who may have, let's say, diabetes, if it's an older patient, and they're on collagen peptide, for instance, that is known to help with, helping with glucose or insulin sensitivity.
Sure.
We know that that's going to get better. Someone told us how their vision was getting better with the eye boost. So really, we're seeing a wide range of things because all it's doing really is helping lower inflammation in the body and fighting off oxidative stress, anything that could be damaging to any cells of the body. And what about the probiotics that also contain prebiotic elements in it, really helping the gut? So what I'm saying is, as we're putting people on these products and targeting certain specific diagnoses, the whole body's getting better, to be honest, because we're really looking at the body as a whole. And so we'll let the patient say, hey, you know, this symptom got better, or I didn't think about this, but my vision's better, my gut, I'm no longer constipated. We hear that. And so we're happy. We'll take the good report for some of these symptoms.
Well, that's wonderful. What is your professional knowledge of why people seem sicker than ever today? And why and how might micronutrients be valuable in them maintaining and reaching their optimal health, regaining, maintaining, and reaching optimal health? Why are people so sick today, in your opinion?
Well, let me give you an answer that dates back to the early 2000s when I started working with kids with autism, and parents were asking me about nutrition for their kids. I started my very first patient, I can still remember, I know the name of the patient, this was in 2000, and I remember the kid was doing very poorly in terms of neurobehavior, aggression, all types of things. And at that time, being conventionally trained, I used medications and nothing worked. You know, the psychiatrist tried things, nothing worked. So I remember out of desperation, I said to mom, what is your kid eating? And I almost fainted when they mentioned the junk food, nothing nutritious.
Mm-hmm.
And then I found out a lot of our patients with autism, that their 4 vegetables were French fries, number 1, number 2, French fries, number 3, French fries, number 4, French fries, and number 4, ketchup.
Mm-hmm.
And so they were all nutritionally deprived. So, and the same thing occurs today. I think that nutritionally, a lot of kids are deprived dietary wise. And so ipso facto, that'll lead to illness and disease. Today, also, we see a lot of toxic exposures, whether mold, whether environmental toxins, whether glyphosates. And then the immune system's weakened. So then they go on antibiotics that disturbs the gut flora, and there's a vicious cycle of illness. And then if you add to the mix stress, that can also cause issues. So there's a field called psychoneuroimmunology. So mind, the psychology, the immune, the brain, all of that works together. So all these things converge to cause a state of illness and sickness that we're doing our best to try to combat and counteract with good nutrition and supplementation.
And it seems to be a problem with children and with the big people, with their parents as well, and grandparents. So, you know, those are the kind of results we hear every day. Every day we hear these. And I've, from my own experience, have witnessed the power of even minor changes in diet, you know, can have a profound impact on how responsive a person's body can be to nutrition. Oh, this is exciting stuff. I love it. Thank you. Do you ever recommend, or when do you recommend, a therapeutic dosaging with a CBD, and why?
Okay. So with the CBD, I'll take the example of seizures because, again, when patients have epilepsy, including significant or severe epilepsy, oftentimes medications may not be used. And by the way, we always recommend that if someone's, let's say someone with epilepsy is going to manage, say, or use CBD in general, that they work with a trained clinician and physician. And I say this because there are certain medications that can interact with the CBD, so one to always be mindful. But epilepsy would be a perfect case where you have to push the dose up. I just use minuscule, small doses, but sometimes you have to use good doses. As a trained child neurologist, I'll look at the milligram per kilogram dose. So I'll always get the weight so I can make sure I'm titrating appropriately. Again, monitoring for other meds and supplements, making sure there aren't any kind of interactions. Also, we work a lot with neurobehavioral patients, PANS, pandas, autoimmune. That's another category where we may make sure we're pushing the dose to the optimal limit, which could be pretty high, more than just 1 or 2 pills. We're talking about kids that sometimes have to infuse with things like intravenous immunoglobulins, IVIG, and other immune modulating treatments. And so by using things like CBD, and we want to make sure we use an appropriate dose, which sometimes can be much more elevated than a regular maintenance prevention dose.
Yeah, that's very interesting. Dr. Paul Corbier, I know that the FDA has approved a dosaging for children that's far more generous today than it was in the past. And could you explain how you use this in your practice? How does this ability to use, more nutrition, larger amounts than you really normally see in terms of the average daily recommended amounts, how do you use that in your practice?
Yes.
Mhm.
So there's the recommended dose or maintenance that anyone could benefit from, even if someone is healthy. But if someone has a disease process, then under our supervision and monitoring that we know that we can bump up some of these supplements. And the CBD was one example because some of this has actually been studied and looked at in terms of dosage. Maybe I'll just plug in as an internist that omega products are excellent too, but like my brother was saying for the CBD, that might have an effect with blood thinning. So as long as we know some of these caveats, we feel very confident in making very specific recommendations and tracking things. So as long as we're monitoring, looking at the disease process, looking at dietary supplement to drug interaction, paying attention to that, we know that we can give appropriate doses to get the appropriate responses for certain disease states. We don't shy away from consulting with Dr. Prasad, too, the formulator. We find him to be a very intelligent person, well-researched, he's written books. And so sometimes we do have to have that type of consultation to make sure we have a good understanding of the micronutrients and their impact in the body. So we look at it clinically, we look at it theoretically, get a good sense of what's safe and what can have a true impact on the disease state.
So when are you moving to Sebring?
Well, I was not too far away. You probably heard of Lakeland, Florida. That's where I have my practice. And I know the Sebring Avon Park area.
Sure.
To go
Yeah,
there, give talks.
I was
So
just
know
in
where
Lakeland the
Sebring
other
is.
day.
Yeah.
That's just my backyard, right? I didn't ask exactly where's your practice located?
So we're right outside of Charlotte, but on the South Carolina side is a place called Indian Land, Fort Mill. So if you look at South Charlotte, right over the border. So to give you an example, my brother lives in Charlotte area. I live in South Carolina, but our houses are 4 minutes away. So,
Oh, wow.
think of it as Charlotte
close.
greater area, but in South Carolina.
Yes. Let me ask, have you shared these products and their powerful results with your colleagues, with other medical professionals? And what has been their openness to using them personally, and how open have they been to using them with their patient population?
So yes, we have shared this whenever we find something that's exciting, that works, that's safe, that's well-researched. We're passionate about sharing that with our colleagues. Our colleagues, like us, are always researching. So when they hear from us that there's a very promising set of products, then they look into it. Like us, they like to try things for themselves. My brother mentioned there was one particular person, for example, a colleague who tried the products, including eye boost, and her vision started improving, and she was very excited about that. So yes, we have shared and are continuing to share these products with our colleagues.
They also like the research. So again, we're proud of the fact that we can say, go look at the studies, go look at how, how much money was poured into these clinical trials and the impact. And so when they do that, I think that inspires confidence. And so we do have like-minded colleagues that do want the best for their patients. So we're only too happy to share something that we find to be really helpful.
Okay. I hope in your plans for the new year that you're considering doing a seminar for practitioners, physicians, because this information is so valuable. And I know you have your own personal network, but physicians all over the world need to know about the results that you're getting, because they truly care about their patients. And they're sometimes so frustrated that the traditional methods that they've been using just aren't getting the results. And they see the pain and suffering that it causes the individual and those that love them. So, you know, applaud you, appreciate the work that you're doing. Would you please comment on the notion that microdaily products are not symptom specific? Rather that they feed the body at the cellular level, doesn't matter what the name of the condition is, that you're going to benefit, this notion, you're going to benefit from feeding your body good stuff at the cellular level, and that it doesn't have to be symptom specific. Would you please comment that and how it supports the body, particular from the typical American diet? And we know that there's so much missing in our diet these days, and we know all the reasons, but comment on how these products will help you no matter what your condition, no matter what the specific diagnosis is, from your observation and experience.
Sure, I'll start. Let me start by giving a broad context. So in our practice, for example, when we see complex patients that have multiple symptoms, not just the brain, but the immune system's messed up, the gastrointestinal system, first of all, we do a very detailed diagnostic workup that involves immunology, genetics, toxins. And what we find is you can start from a broad trigger, whether a particular toxin or genetic issue, and that boils down to cellular changes. And often the net effect would be inflammation in the brain, in the gut, and other organs, and oxidative stress that affect the tissues. What that means is by providing good, well-studied, safe nutrients as microdaily nutrients, that can help the cells respond very well. It can help the mitochondrial system. There is something called the cell danger response, where the metabolic need and homeostasis is disturbed, and all of a sudden you get this chain reaction that affects the mitochondria. You get all types of attack on the host, and all of this could be dealt with properly with the right type of nutrients and right support for the mitochondrial system, and approaching things at a cellular level that'll then translate into general health, wellness, and not just a particular condition, but helping multiple organs to respond. So I think these supplements do work at a cellular level in restoring proper function, which is, I think, exciting.
I'll just add to that yeah, so we're more interested in the root cause of things than just a superficial symptom that might mean something deeper. And so if you're getting at the cell level to reduce inflammation, to prevent what my brother said, oxidative stress, then any number of good things could happen. Sometimes we can't even predict what's going to happen first, and that's okay with us. Someone might say, hey, my headache's better, I have a little more energy. Hey, more power to that person, because it's a deep cleanse, deep restoration. By the way, we like the word restoration. So yeah, it is at the cellular level, and we're very happy about that.
Okay, thanks for that. What would you say to other medical practitioners like yourself, with a variety of specialties? What would you say to them about considering adding this line of micronutrient products to their treatment protocols? How do you encourage them? What would you say, and how do you encourage them to do so?
Yes. Well, I would, first of all, a lot of providers, when I worked at the hospital as a child neurologist, there were a lot of cases, pediatric cases of headaches and other things that did not always respond to traditional meds, or maybe meds were tried that caused side effects. So even though I was in a milieu, an environment where they weren't very open to, nutrients and supplements, I recommended those, and patients got better. And since then, I became more bold in recommending nutrients and supplementation to help. And so we're always open to recommending nutrients to colleagues and supplements that we know will help. Again, having a good research basis, evidence basis for those supplements, and explaining how they work, will speak for themselves. So we plan to continue doing that to all of our colleagues, is to share with them the utility of introducing nutritional supplementation such as the Micro Daily, which we think can be of great help.
The other thing I might say that we notice and for our colleagues is if the colleagues are not recommending micronutrients to the mix as part of the armamentarium of treatment protocols, they should, but some don't care about it or they don't. But I can assure you that their patients care about it. So sometimes they'll have patients saying, hey, what best dietary supplement do you recommend? Or what digestive enzyme or what multivitamin or something for inflammation? So what we would tell them is, hey, here are the best products in each category that we have found to be great, works for us, well-researched. And so that's another way of communicating with our colleagues of saying, here's a missing piece that we think is great, scientifically validated. When your patients come to you asking questions, at least you'll have a reasonable answer. So I think there's a niche for this.
You're so right about that. Even if the physician is not aware or think it's their responsibility to make recommendations about supplements or don't care, their patients care. So
Yes,
that's
absolutely.
a very good place to encourage them to start from, because I know they have a lot of responsibility, but people really are learning, and it's growing, that lifestyle changes, adding proper nutrition to their diet goes hand in hand with any good medical treatment protocol. So I really admire you're doing that, because that's not just serving your patients and your family, but that's serving doctors who are going to influence thousands and thousands of people. So inadvertently, you are just helping on a very large scale. And I want to acknowledge you and salute you for that and appreciate you for that, because it's physicians like you that are going to help people feel better, because how sick people are is just continuously amazing to me, just amazing to me. But anyway, we're having a meeting in the Charlotte Ballantyne area in January that you'll be helping with. What are some of the goals that you will be wanting to accomplish in your community and educating people as far as health is concerned? What are some of your goals for that upcoming seminar?
Well, to answer that question, let me just give a little background. I mentioned that I went to the Mayo Clinic. This was back in the 90s. I did part of my adult neurology training. And the most important lessons, of course, I learned a lot of neurology there because we saw rare cases from around the world. But one of the things that I learned there was the idea of collaboration, because that center there, they were all about collaboration. That's what we want to bring to the Charlotte meeting. Wellness-based providers that are well-intentioned in helping their patients bring the understanding that micronutrients can help. So we want to collaborate because we believe that a lot of us are seeing complex patients, sometimes unique conditions, difficult conditions. So in the January meeting, we want to talk about how do we get together, share ideas, promote a common goal of discussing micronutrients and the science behind it so that our patients that are suffering, many of them are suffering, can have life-changing supplementation that can improve their quality of care. So collaboration, coordination of care, sharing of information, all of us have a piece of the equation, but if we put our heads together, we'll continue to learn and grow. And maybe also discuss research. If we all share information, monitor, we could probably together, research certain things that we see clinically and fine-tune protocols that we're already starting to work on.
Yeah, I agree with that too. I was just before we came in here, I was talking to a cardiologist who is interested in the role of micronutrients on cardiovascular health. So just plain old education. How does this impact the circulation? How do you bring down the diabetes, weight control, all these things? So as we can document the real impact that these things have, and share this with our colleagues and educate on a routine basis, the patients will be better for it. So that is our goal.
Wow, bless you, bless you, bless you. Well, I recommend that event in January be produced and recorded, that you record it, produce it, have it recorded so that you can edit it to your satisfaction, and that be your first product that can be sent around the world to tell them about the wonderful work that you're doing. and the wonderful results that you're getting. And it just might help someone in some village somewhere, some small town somewhere, and will help and encourage physicians that don't have your particular background and exposure to wellness, be willing to take on an additional tool in their fight of disease, fighting out disease. So I highly recommend that you produce that not just record it, but have a team come in, record it so that you can edit it, turn it into a product that will be extremely valuable to the rest of the people in this country and on this planet. So I want to thank you for your generosity of time. I want to thank you for and acknowledge the work that you're doing. I want to acknowledge that you are doing God's work, in my humble opinion. I want to thank you for all those parents who are sleeping better, all those children whose lives that you've influenced. And even though it's demanding and tiring and a long day, there's nothing small about what you're doing in life. And what you're doing can be a beacon to other people, other practitioners, other physicians. And as parents and individuals listen to this tape, they can be encouraged to add nutrition, micronutrients to their treatment protocol, whatever they're doing, exercising, hydrating, meditating, whatever else they're doing, taking their medications, that this product and these products, and do comment on the fact that these products don't have a counterindication with medication. They need to hear that from you, not from me. Please make a comment about medication and micronutrients. Please.
So that's one of the very important and interesting things is safety, because in our practice, we emphasize safety for adults, but also kids. And so the micronutrients we think are very safe and can be taken with medications. We still recommend monitoring with physicians, because sometimes patients, like to do their own thing, but we recommend working with providers that understand, that can guide and support, but they are safe and can be taken with medications, which is a plus.
So, thank you. So any last minute comments from either of you before we close?
Well, I think one thing that this Engaged Micronutrient company has provided, and we'll mention Dr. Prasad, who was willing to also help us with protocols, and everyone, you, Jane, Beth, and everyone else, the whole team. We like that collaboration as well and support. I think we've met several people in this company, and the vision to make people well is that there's hope. We love the word hope. And we feel that if something is scientifically validated, that minds are coming together, people are compassionate, have the passion to get people well, then that equals hope. So we want to reassure people that there is hope.
Yeah, wonderful one. There is indeed. Thank you for that.
And I was just thinking of an experience. I worked in the hospital where we are here, a large hospital system, for several years, and ended up leaving the hospital so I can start this clinic and be more autonomous. But I remember toward the end, there was another child neurologist who was very conventional, who did not want to hear anything about nutrition, dietary supplements. But the last day before he left, he took me aside and said, "You know what, I've been looking at what you're doing and the supplements, and I tried it on a couple of patients secretly because I didn't want anyone to know what I was doing. I saw some great results, but I did secretly. Thank you." And so, but he was very resistant. I mentioned that because one, there's some physicians that just don't know or scared to venture because they're trained in a certain way. And I mentioned that because we have a mission to share this not only with patients, but with providers, and through a duplication effect, they can share it with their patients. So we have a job to do to educate not only patients, but providers that are well trained in their field, but need to have a better understanding of the role of micronutrients in health and disease.
And that's so needed, so essential, and increasingly welcomed. Well, I thank you both for your precious time. You've been very generous, and I really, really encourage and acknowledge what you're doing. And I'm going to tell the world about you. So just know, and I look forward to hearing the results of that seminar in the Charlotte area in January. I really look forward. And I think the nice thing about media is you can do it one time and it can be duplicated a million times. So you don't have to give a million seminars or a million interviews like this. But thank you so much, and happy, happy, happy holidays.
Happy
Thank you,
holidays
Jane,
to
and
you.
happy
Thank you,
holidays.
Jane.
Thank
Thank
you.
you. That's possible. We appreciate that.
Thank you.
Beth.
Oh, Beth, you're on mute. You're muted. Beth, you're on mute. Beth, you're on mute. We can't hear you.